Vitamin K deficiency is one of those things that stays quiet for a while, until it doesn't. BMJ often frames it as a bleeding disorder first, not a vitamin issue. And that distinction matters, I think, because the symptoms usually show up in the body's failure to stop bleeding properly. Here are the key signs and symptoms of vitamin K deficiency, explained simply, in a clinical but human way. 1. Easy bruising. Bruises appear after very minor bumps. Sometimes you don't even remember hitting anything, yet there they are. This happens because vitamin K is essential for activating clotting factors. Without it, blood vessels leak more easily. Prolonged bleeding from cuts or wounds. A small cut that should stop bleeding in minutes keeps oozing. Not dramatic, just slow to stop. BMJ highlights this as a classic early sign. 3. Nosebleeds or bleeding gums. Frequent nosebleeds. Gums that bleed while brushing, even gently. It's often mistaken for dental problems, but the root cause can be impaired coagulation. 4. Blood in urine or stool. This one can feel alarming. Stools may appear dark, tarry, or visibly bloody. Urine may look pink or red. BMJ notes gastrointestinal bleeding as a significant red flag, especially in severe deficiency. Heavy or prolonged menstrual bleeding periods that are unusually heavy or last much longer than normal. Sometimes this is brushed off as just hormones, but vitamin K deficiency can quietly contribute. 6. Internal bleeding, severe cases. This is rare but serious. Bleeding into the brain or joints can occur, particularly in newborns or people with malabsorption disorders. BMJ places strong emphasis on this risk in infants, known as vitamin K deficiency bleeding, VKDB. 7. Poor wound healing. Cuts take longer to close. Scabs form slowly or reopen easily. Clot formation is the first step in healing, and vitamin K sits right at that starting line. Who is most at risk, according to BMJ-style clinical reviews? Newborns, especially without vitamin K injection at birth. People with chronic liver disease, individuals with fat malabsorption conditions, long-term antibiotic users, those on anticoagulant therapy like warfarin. To be honest, vitamin K deficiency isn't usually loud at first. It whispers through bruises, bleeding gums, slow-healing cuts, and those whispers are easy to ignore until they're not.